Hi, I'm Parvathi Kashyap, Clinical Psychologist, Oncology Department, QNRI Hospital, Sitamdara, Visakhapatnam. It being February month, the prevention of cancer, I'm here to tell you a few points on how to cope up with the emotions occurring due to the diagnosis and the treatment of cancer among the patients and among the caretakers and the loved ones. We must have experienced in every house, every family, every house, or in the nearest or dearest about this. People suffered from it, people have died, and there are also people who have come out of it and for living for many years. So the success stories are there. If you're diagnosed with cancer or a person in your house is diagnosed with cancer, next what to do? Will you drop the idea? It's not the end of the world. Of course, some people must have died of cancer, but there are also success stories where people have come out of cancer and they are still living. So, to which category would you like to belong? The choice is yours. If you wish to be in the line of the people who have succeeded, you will get the ticket for the success. And suppose you think, no, this is really dangerous and then so many people died, I may also die. That means you are changing the route and you are moving towards the people who are not successful. You go into that path, you talk to the people and you find out why they are not successful. That's wrong. You should first of all find out what are the success rates here. 50% of the people come out of cancer and 50% of the people don't get cancer because they are using the preventive methods. So this is the success story. Just go and ask the people who have succeeded in getting the treatment and coming out of it and happily living. So that is where you have to stand. Okay, now just let me put in a word over here. When you are diagnosed with cancer, the immediate thing you have to do is, come on, guess what you will do. Generally, 90% of the people go and ask the people who do not know about cancer. And the people who have to answer, they will never say no to your question. They will simply cook up something and give an answer, and they have a sadistic pleasure of saying that cancer is very dangerous, people die, so and so person died here, so and so person died there. Where is the problem? The problem is not with their answering, the problem is your approach is wrong. You should approach a person who has succeeded in the treatment. Just hunt. Go hunting. Who are the people? Google and see who are the people who are successful. Not about the disease and not about the seriousness. Now hunt for the people who are successful. Just go to them, talk to them, and you will really love talking to them because you are getting people with a positive attitude as to how they have come out of it. Then you can also make your strategies and plans how to come out of it, and in doing so, you are already on the path towards success. When you catch the bus leading to success, will you reach the goal or not? That should be your attitude, and all those people who have succeeded in getting their cancer cured and not recurring is just because they have taken the right path. Now the choice is yours, whether you are going to choose a bus that has fallen into a ditch or the bus that has reached the goals. So I would like to tell you here is, you first of all hunt the people who are successful and talk to them, find out how they could be successful, and then you will be very comfortable, and once you are comfortable, your travel will be comfortable, your journey will be comfortable, and you are giving an opportunity for the doctor to coolly think on the strategies on how to cure you, and that is how you come out of it. then I just want to request the caretakers too. I have a word for the caretakers too. The caretaker should not take this news and then keep on discussing with people, and that should not be a topic as to how serious it is, what is happening, and how some people have suffered. The caretaker should be very careful, very caring, very loving, and then focus on the patient only and give a lot of company in not telling that don't worry, nothing will happen to you, but that because that particular word of don't worry, nothing will happen to you is not your duty. That is the duty of the doctor to say to what depth he is in and how to cope up with it. And your duty is to give him an emotional support and say that whatever the case may be, all the people are successful and you will also be successful, and in that temporary period of your weakness or having some ailments or inconveniences, we are there to stand by your side and take care of you. Don't worry, we will fight it together and we'll come out of it, and we are going to tell to the people in public like this that your journey towards the reaching of the goal successfully to come out of cancer has become really very successful, and that is how it will motivate the other people also to come forward to go for the screening test or maybe the diagnosis and afterwards the treatment and successfully come out of it. So just like any other problem today, cancer is not deadly. It is simply a problem that has come maybe due to some reasons, but you have to come out of it, just like your COVID or maybe your hepatitis B or any other diseases. This disease can also be cured provided you are cool and you keep your people cool and you keep your doctor cool so that he can cooperate with you and coordinate with you in your treatment. Love you so much and pray for your success journey, and you would definitely come out of it because God is also there to take care of you. If you help yourself, God will help you. Thank you. Have a great day.